there, friends, and welcome to Season 9 of the Lighting Your Way podcast. This season, we are continuing one of my favorite parts of the show, talking with patients about their own personal journeys through the healthcare system. These are real stories from real people, sharing the ups, the downs, and everything in between. It is honest, heartfelt, and as always, it's a reminder that no one walks this path alone. So join us as we shine a light on the challenges and triumphs of navigating healthcare. Here's to another season of connection, compassion, and hope. Hello, podcast fans. I imagine that many of you have gone to the emergency room to seek emergent care. And when you get there, it's a little bit chaotic. There's a lot of people running around and not a lot of communication happening. So imagine, if you will, if you are an 81-year-old woman who suffers acute right-sided eye pain, goes to the emergency room, and then during the diagnostic workup, they tell you that you have atrial fibrillation, which is an abnormal rhythm of your heart, unbeknownst to you. This is the story of Miriam Rivkin, who is that 81-year-old woman, and her journey through the emergency room recently, a few months ago. So I hope you enjoy this episode, and I do hope that you learn some lessons from it. After some lively conversations here with the team at the Lighting Your Way podcast, we decided to bleep out the name of one of the hospitals in this podcast out of respect to the hardworking professionals there who did not drop the ball in this awful situation. Welcome to the podcast, Miriam Rivkin. Happy to have you here. Thanks for coming.
Well, thank you for inviting me, and I hope I can be of some use, some information that's useful.
I am sure, given what I know a little bit about your experience of late in the healthcare system, thanks to your daughter, Rebecca, who is my colleague at Guardian Nurses. I think you'll have a lot of advice and certainly insight to share. So thank you for being willing to come on and talk to me.
Sure.
So as I said, we are talking this season again with patients who have had recent experiences in the healthcare system. And, some of them have been good, some of them have been not so good. But what I'm interested in is talking about like your experience and how it worked out and how Rebecca helped and what you'd like other patients to know. So why don't you start, kind of give us a history about how this recent interaction with the healthcare system started.
Okay. Well, we go back to towards the end of September, and I was having a little trouble with my left eye. It was blurry. I thought there was something in it, but I just couldn't do what I had to do to get it out. So then I started to have some crazy colors in the eye, and I thought, well, something definitely is wrong here. Right. So I did what they tell you not to do, and I went on the web and researched.
Okay.
And as I was doing that, it became apparent that I had a detached retina, which I knew nothing about. I read about it. It can be very serious. It can lead to loss of vision. Yeah. So the next day, I went to the ER at Wills Eye Hospital, which has a national reputation, and it's sort of, not many of them in the country right now. And so I went to the ER and waited a little while, and then was called in for the triage, and she asked me some questions and then did my vitals. And as she was doing my vitals, she said to me, do you know you're an AFib? And I said, AFib? What do you mean? I mean, I know basically what that is, but no. And she said, do you have a cardiologist? I said, no. And
what about my eye pain?
Yeah, right. And she asked me a number of questions, I guess, about symptoms that would show with AFib, and it was no to all of them. So she said, well, you are in AFib, and your heart rate is off the charts, so to speak. And I said, okay. And she said, hold on a minute, I'm going to go in the back. So she went in the back, and then they called me in, and I said, look, whatever you do, please look at my eye.
Yeah.
The doctor did look at my eye, and he unfortunately confirmed that it was a detached retina.
Oh.
Meanwhile, they're all sort of talking, and they say, we're going to send you across 2 blocks to hospital, which I believe they at one time were affiliated with.
Okay.
And because of the AFib, you need to go in as an emergency. So, I mean, I was
were you by yourself at this point? Like you just...
I was, I was, because
yikes.
we, I live within walking distance to Will's Eye, and my husband was at work, and I just figured, well, I'll go to the ER and see what they say.
Okay.
Not expecting.
And you went down like early in the morning?
No, it probably was, it was fairly early, maybe around 11 by the time I was called in.
Okay.
So the doctor, the Will's Eye doctor said, you're going to have to go over there. And however, we're going to have to coordinate and make sure that we take care of your eye in the next few days, because it's already been a couple days, and they like to do it as fast as they can to correct the tear in the retina. I said, okay. I mean, I was like, all these people surrounding me telling me these things that I was so shocked to hear. So anyhow,
Miriam, you didn't feel any symptoms from the AFib, like the palpitations or shortness of breath or anything?
Breath or right.
And you don't have a history of AFib?
No, or heart problems.
Okay.
No, none at all. So anyhow, they put me in an ambulance, and they didn't even want me to walk over. Put me in an ambulance and took me to the ER. And I guess that's where my not so great experience began. Anyhow, the ER at that time was extremely crowded. They didn't know why there were so many people. They hadn't seen so many people since COVID, whatever. Anyhow, so they put me on a gurney in a hall near the entrance to the ER, and I was on that gurney, fully dressed, for 28 hours.
Oh my God!
Yeah.
Oh, I mean, so were you? So Will's Eye just put you into the ambulance and sent you to. What happened when you got into the ER at?
Well, the paramedics from the ambulance explained to the ER person who happened to be there at the time what they had found while I was there in their ER, and said that they thought somebody should take a look at me, right? And follow up on this, because it was pretty severe AFib. So they did not have a room in the ER, and I was put on this gurney, and they said, as soon as we get a room, we'll put you in a room. Not,
Well, did they
I'm,
do it in EKG or did they do your blood pressure?
well,
Like, what was
yeah,
the?
that's part of the problem. So anyhow, they put me on the gurney. I think somebody did blood pressure. My blood pressure, even in the other ER, hadn't been horrible. And they did not at that point do an EKG. As a matter of fact, they really didn't do anything. I figured they would hook me up to some kind of heart monitor or something, but they did something.
At least.
At least, but they didn't. And I don't know, in the back of my mind, I knew that AFib, the risks of AFib is stroke.
Right.
And, that's why I assumed that, a heart monitor or something. Anyhow, I was there. By this time, it was probably about 1 o'clock and in the afternoon. And other than taking my blood pressure, nothing happened right then. As a matter of fact, nothing really happened until late in the afternoon when some people from the cardiology department there came around and asked me, basically all the same questions. And
Right.
they said, well, we're going to get you an echocardiogram so we can actually see what's going on in the heart.
Okay.
And, then we'll come back after we have the results and we know more.
You said,
okay.
promise?
Yeah, right.
Please
So at that point,
come back?
yeah. Okay. Anyhow, other than, I'm trying to think, other than checking my vitals, my blood pressure, and my heartbeat. And when they did that, they said, oh, well, you're still in AFib. And I said, okay. And they did get all my information in terms of medications I was taking and a little bit of history that were in the files. And I really didn't see anybody else. I was up all night because the ER was so jammed, so crowded.
Wow.
It's still in my clothes with a little blanket over me.
Wow.
And, the vitals were checked when, as they do when everybody's vitals get checked.
Yeah.
They did give me a pill. I think it was magnesium.
Oh.
Which I wasn't familiar with.
Did they tell you what it was? I mean, did they say?
Well, I asked. I said, why am I, what is it? What is this pill and why am I getting it? And they said, well, it helps with AFib. I said, okay. And I'm trying to think if they gave me any of my other medications at that point. I don't think, well, I had taken medications in the morning that I take.
Wow.
And I think that was the only thing they gave me that night.
Wow.
So, so the next morning, I asked the nurse, I said, I know I'm going to have a echocardiogram. Can you tell me, where I stand, where that's concerned in terms of timing? And she said, well, we're so busy. Let me check and I'll get back to you. And I didn't hear back from her. So basically, I was just there, on my little gurney. And
did they put you in a gown at all, or encourage you to get into it again? So you were still in your street clothes.
I was in my street clothes
on the stretcher. Did they feed you? Did you get food or
That's
anything?
That's a good question. I think I had something, but not from. They might have offered me a tray, but I didn't want it. And then my granddaughter came over and she got me a sandwich. And
Okay.
yeah. I mean, I knew I had to have something, and I had water. I knew I had a drink.
Oh man. And so you go in
Yeah,
at 1 o'clock, and now the next morning you're still dressed in your street clothes, wondering when
correct.
the echo is
Waiting.
going to
Yes,
be done.
exactly. Waiting for the echo. And of course, the night I was that night, I mean, my daughter came, my husband came, totally shocked, or everybody, and there I was,
Wow.
and and then the next morning, I couldn't really get an answer about the test that I was scheduled for. And of course, I asked several times about a room, and they said, "Oh, we're trying our best to get you into a room." Meanwhile, still no monitor, nothing.
Oh, geez. Did you
Yeah,
ever think about just leaving?
I did, but truthfully, I was afraid to leave
Yeah.
because I thought, if the AFib and my heartbeat was that fast, I don't want to stroke out somewhere. It's better
Right.
to stroke out in the hospital.
Right.
So, but I did think about that. And I'm trying to remember exactly the timing. Oh, so a little, probably in the early afternoon, doctor who is the head of inpatient cardiology and his, I guess all residents or students, there's a whole bunch of them, came to the gurney and asked me, basically the same questions, which I understand. And he said, well, you're scheduled, you're going to have that the echocardiogram. And I said, yeah, I've been waiting all day for that.
Rumor has
Yeah.
it.
Yeah, rumor has. So I think he said to one of them to check. Well, we'll check that out, make sure you get that soon.
Yeah.
And then he talked a little bit about AFib, and he said, "Oh well, AFib now we'll take care of that. It's not going to be a problem." I said, "It's not." He said, no, there are new procedures that are being done that really do that can stop the AFib.
Okay.
And yeah. And I said, oh, okay, that's good, good to hear. And he was very so sure of what he was saying. He said, oh, yeah, we'll do a cardioversus, it's called.
Okay.
I said, okay. I said, well, what is that? And he said, well, it's very easy. He said, it's just a non-invasive procedure that is done with catheters, and it stops the clots from getting to the heart, and will hopefully get your rhythm back to what it should be. I said, okay.
That's not a great explanation because, it's
Yes,
easy on him,
that was
not so much easy on
right,
you.
exactly. So I thought, I better go back on the internet and find out what this is all about. So he said, well, we'll see you after the echo.
Okay.
I said, okay. And he looked at my medications that I was already on, and I think he said, well, you're going to have these two today. I said, okay. And then they left. The entourage left. So finally, I guess it was, I don't know. It was probably about 4:30. They came to get me for the echo.
Wow.
Yeah.
Wow. So much for the word emergency or urgent, right?
Right. And they were when I was at Willside, it was such an urgency, which I understand, And okay, so they took me down to get the echo, and that was fine. And I said, well, when will the results be available for the cardiologist? And the doctor who did the echo was actually very nice and helpful. And he said, oh, they'll be available very shortly. I said, okay. So then it was like about 4:00. I finally got into a room. I guess it was about 7 or 8 o'clock at night.
Oh, wow.
Yeah, that I got into the room. And by that time, I was so tired I could barely see straight.
God. Yeah, I'm sure you didn't sleep at all.
Not
right?
at all. No,
Yeah.
I couldn't even close my eyes. Or if I closed my eyes, it was for a couple minutes. Yeah.
Wow.
So I got into the room, which was very helpful. And so the next morning, now remember also, I have to get out of there so I can get my eye surgery. That was really bothering me that, this time was passing.
Right.
And
did they know that you had a detached retina?
Oh, yeah.
Okay.
They knew that's how I got there was from, one ER to another. It was on the chart. And so that was a Tuesday when I got there. Anyhow, and they really wanted to do the surgery before the end of the week on my eye. So the next morning, the entourage comes into the room and says, I had said to him the day before, you're going to have to coordinate with Will's eye because it's very important that I get the surgery done as fast as I can.
Right.
So any procedures on the heart are going to have to wait. And he was fine with that. Anyhow, he had one of the people from Will's eye actually came over to check on me and asked who was the cardiologist that was handling it. And I told him, and he said, well, I'll go talk to him. So the thing that they had set up was that I would, the next day, which was like the 19th, I would go over to Will's eye after I was released from and get the surgery that day, which was okay with me. I just wanted to get it over with.
Yeah.
And yeah. So what happened next is the resident who came from Will's eye to talk to the doctor told him that he was going to send over papers that the cardiologist would have to fill out to show that I was okay to have surgery from his point of view. Otherwise, cleared, right, exactly. And he told me that. And so that was set up, and I was happy. It was not an overnight. It was an outpatient procedure. So I could go home the same day.
When did they discharge you? Because did you get to a room? You got to a room, right?
I got a room that the night. This is the next day.
Okay.
Right.
Okay.
I got after the 28th hour. I got to a room, and I did get a little bit of sleep. That was good. And so this was the next morning. That the Will's eye resident was talking to the doctor, not in front of me, but was going to have this thing, and they were going to set it all up so that I could literally walk over to Will's eye and have the surgery, and then go home that night.
Well, what about the AFib?
Well, the AFib was still there. It
Yeah,
wasn't,
I was
yeah.
going to say.
And then, yeah. So at that point, I didn't know. So then the doctor comes back, the cardiologist comes back and, told me what was going to happen about the surgery and so forth. And then he said, I said to him, well, then what happens with the other condition? And he said, well, I'm going to set you up with a cardiologist, and you'll see the cardiologist. Yeah, you'll see the cardiologist, and then we're going to set up a time after your surgery, and we know that you're doing okay from that, and you'll have this cardio
version,
yeah. And I said, well, who does that? And he said, oh, we've got the two best guys in the country who are going to do that. Literally, that's what, yeah. And I said, oh, and he said, well, and then the new cardiologist will set up an appointment with the surgeon, one of these two, who will do the procedure. Well, at that point, I was so anxious to get the eye surgery and get out. I just said, okay, thinking I would worry about that after the surgery. And I would talk to my daughter, Rebecca, and others who are well-versed in the medical procedures and worry about it then. I just wanted to get out of there.
Sure.
So,
at what point did Rebecca, I know your husband was there, your granddaughter, when did Rebecca come in and intervene at all when you were at ER?
No, she was there, but we sort of decided not to do much intervention then, just to get me back to
Will's Eye.
Yeah.
Okay.
Get me back to Will's Eye.
Yeah.
And then she said to me at that point, look, don't worry about this right now. Let's worry about the eye. We'll take care of. We're not going to let you just have this other procedure without doing research and finding out. I will find out who's the best, and we'll take it from there. You won't have to wait. We'll work on it. You won't have to wait 2 months for an appointment. I said, okay. I think she was more or less also trying to calm me down.
Sure. Right. I mean, we don't want your heart rate to go up anymore.
Exactly,
You're worried about your eye.
Yeah.
Right. The whole thing.
And I knew that what she was saying would happen. I know what what you guys do and how well you do it. So I thought, I'm in good hands. She knows I'm in good hands. So anyhow, the worst was not over yet. They did discharge me. We walked, my husband, Rebecca, and I went over to Will's Eye, went on where we were told to go. And it turns out that this head guy, cardiologist, never filled out the papers that he was supposed to.
Oh.
He made a phone call. He made a phone call to someone there and told them it was okay that they could do the operation, but never took the time to fill out the papers. Well, they have to have the papers filled out, signed.
Yep.
Yeah. A phone call isn't good enough no matter who you are, even if you're the head of inpatient cardiology. So they, when we went there, I guess she was some type of an administrator, very lovely woman, came out in the waiting room and explained to us what the problem was. And meanwhile, I'm supposed to have the surgery that afternoon.
Oh, geez.
Yeah.
This is worse than I thought, really. I mean, just the back and forth and the waiting and
I
the.
know. I know.
Meanwhile, you
I
have a
know.
detached retina, right? And you
I
want to get
do.
it.
I want to
Okay.
get it fixed before I go
Yeah.
blind in that eye. Yeah. So I said, well, if you personally called him now and got that information that I'm okay for surgery? She said, no, I can't do that. So what we had to do was go to see their cardiologist. They have a cardiologist who they is not on staff, but they use, and they would have to go see them in person, and they would have to clear me for the surgery.
Well, why, if they had a cardiologist on staff, why didn't they just let you see that cardiologist back
No,
3
they
days
didn't have one.
previous?
No. Yeah, they. What do you mean?
Right. They sent you over to because you were in AFib. They could have
Right.
just
They
brought the
don't have a staff. They don't have a staff cardiologist.
Okay.
This is
Okay.
a cardiologist in private practice who's about a block or so away
Got it.
that they use in certain situations.
Okay.
Sounds
Sounds like they could have used it for you, but you would have had your surgery 3 days sooner.
I know.
Jeez.
So, but I didn't think they wanted to get involved in that. They were, I think they just wanted me in a hospital for that.
Yeah.
So, they called ahead and we walked over to the cardiologist. And
I love that you walked over, right? Like you,
yeah.
Nobody wanted to let you do anything, but then you walked around downtown.
I can walk over, right? So we went over there, and we didn't have to wait too long. There was an office full of people, and they did a blood pressure, asked a lot of questions, and they said, "All right, you can have the surgery." By this time, it's like 3:00 in the afternoon.
Oh, so too late to have the surgery that day. Yeah.
Well, they would have done it, but I was so exhausted and so upset at that point that I said, "Can we come back tomorrow?" And I hadn't had anything in my mouth or to eat or drink, which would have been good for the surgery, but I was feeling very weak. So they did go and set it up they knew all the circumstances, so they set it up for the next day, which was Friday the 20th.
Wow.
And that's when I had that. And it went very well. The recovery was very annoying, but it was okay. There was no pain the whole time, which was quite amazing. And but you have to lie in a certain position for days and, whatever. Anyhow, it was healing very well. So then Rebecca said, well, we're going to switch you over to Penn.
For cardiology?
Thank you for that. Anyhow, they got an appointment, excuse me, very quickly with the group that handles, it specializes in handling AFib and such. Okay. So I went to see them as soon as I was allowed to from, my eye was healed enough to go over there. Oh, excuse me. And I met with a cardiologist who I think has been involved in these cardio procedures for AFib for many years. I think he was I think Penn actually was one of the leaders in the technology. Okay. And he was wonderful, absolutely wonderful. He explained everything to me so carefully and in terms that I could totally understand, very calmly, and his suggestion because he was suggesting things, and then he was going to give me all the information and I could decide, was that they do a procedure called a cardioablation.
Okay.
Which is similar to the other procedure, but they have found that it has better results. And at the same time, they would do a procedure called a Watchman, which is a procedure that helps to prevent clotting, and also means that you don't have to be on blood thinners forever, just a short time. And he thoroughly explained what was involved and said, to think about it and then decide what you want to do. I asked about the cardioversus, and he explained to me why he thought this procedure would be better. And, he was so thorough and answered every question that before Rebecca was with me, and before we left his office, I said, okay, I want to do that. I had enough information, and I thought that would be the best solution. So he said, well, we're going to have to wait about 3 weeks till your eye is really healed before we do it, he said. But he also gave me meds.
What a concept.
Yeah, what an idea. He changed a lot of my meds and gave me new ones, and he said this will help with the AFib, and set up a date while I was there for the procedure. And when I left there, we both Rebecca and I felt really good at that point, that this could be taken care of, could be solved, and that I would get good care.
When you think, if you hadn't had, I think this is a leading question, but how has having Rebecca by your side as a nurse helped you through this? I think I've heard it multiple times, but
yes,
how would you describe it?
It made all the difference. It really did. First of all, just going to this group and talking to him, it was quite obvious that they had picked or had chosen to pick this particular cardiologist, who I thought at that point had really calmed me down.
Okay.
And I knew if it hadn't been for Rebecca and the team, I wouldn't have known who to, I would have gone to Penn, but I wouldn't have really known who at Penn would even say. Who to even try for first, it's kind of, but having them do that legwork for me was fantastic. And it just made all the difference. It really did. When you're facing this alone, I don't care how much research you do or whatever, but you're never really sure you've picked, somebody that you should pick.
Correct.
Yeah. And this really changed. And they were able to get an appointment so quickly. I never would have gotten an appointment that fast. I know it.
Well, it's good for you, and good for having a nurse in the family, as we say.
Oh, absolutely.
It always helps. Miriam, when you think back on this, it sounds, as I said, it sounds a lot worse than what I originally thought when I heard about it. Just hearing it from you, right? But when you think back on the episode, what is really the most frustrating part of of having that experience? What was the most frustrating part of it?
Well, I think that my experience in the ER and when you're in the ER and you're just sort of there, you have no recourse. Like, what do? When you know that if you leave, and I am the kind of person that would leave, but because nobody came and explained anything to me about any more information on the AFib, I was really afraid to leave.
Yeah.
And that plus the fact that they really didn't see this as, or really realize why this was an emergency, you know? I mean, I'm told at one place, this is a real emergency. They didn't tell me to walk over. They sent me in an ambulance.
Right.
So, and then I'm in the ER, and I mean, I felt so bad for the nurses because they were overwhelmed, but not to the point where I shouldn't have had more attention.
Right. Do you think that if there's anything that could have impacted your experience more positively, do you think it's having people explain things to you? What would have mattered to you at that point?
Absolutely. Having, somebody come over and say, look, we know you're an AFib. We're monitoring your blood pressure and your pulse. And I would have said, yeah, but I'm still in, am I going to have a stroke? Am I an AFib to that degree?
Right.
Nobody took the time to really explain, including that cardiologist. He was just telling me it didn't matter to me. What he would say, it doesn't matter what you want, this is what we're going to do.
Exactly.
I mean, really. And, so, I mean, just somebody or a few people to give me more of an explanation. Remember, I didn't even really know what the heck AFib was. I mean, I knew about it, but I didn't really understand it.
Right.
And, when the triage nurse at the other ER said, we have to get you to the hospital, it's like, oh, okay.
Correct. Correct.
Yeah.
So have you been, when's the last time you were in an ER besides this time? Like years? How long has it been?
I have to say, I should preface this by saying I've been a very lucky lady. This was the first time I really had a hospital stay other than when I delivered my kids.
Wow. Good for you. That's great. That's wonderful.
Yeah. I mean, I had a few small procedures, but they were all outpatient.
Okay. So when I think about the ERs of yesteryear, versus the ER of today, right? It's a much different experience for sure.
Yeah, no, I've been in ERs. I mean, years and years ago, I broke my wrist and I had a couple breaks, but this is going back. And it was a totally different experience. Yeah, totally. I mean, I was I had to wait, like everybody has to wait in an ER, even years ago. Right. But it was a very different experience. I mean, this was really chaos. I mean, that's the only way I can describe it.
Oh, I hate hearing that because we've heard that term before. What kind of advice would you offer older adults about advocating? Like you had Rebecca, right? You had your husband there, but what would you suggest to older adults who are in an ER, maybe in a similar situation, to advocate for themselves? What would you like to say to them?
Well, I would say to them, whatever you do, ask questions. Don't assume that everything you're hearing is the right information. Right. Ask questions. Don't be afraid to say, well, I don't know anything about, why are you giving me that medication? Always ask and wait for a answer, and then know that you can say no. Not necessarily to a med, but you can to a med too, or to other things that they want to do. Just tell them that, no, you don't have enough to go on to make that decision. And don't be afraid to say that.
It's good advice.
I think that's really important piece of information, that it's okay. They hear that from others too. You won't be the first person to say that.
Right.
And and that's more important than just agreeing to everything.
Right, and if it's life-threatening, it's a different story. But when we talk about elective procedures,
Right.
it's a different.
I mean, right. If you had a heart attack, you're not going to say, "Don't treat me." But
right.
Yeah, that's true. I didn't think of it in those terms, but definitely, yeah.
Miriam, what would you like to say to any doctors and nurses who are listening?
Well, I've thought about this, and I think that it's really important for doctors and nurses to remember that most patients are laymen, and their questions that they ask, the patient asks, are very important to, gaining some understanding of the situation and feeling maybe somewhat in control. And then when the doctor or the nurse does answer the question, make sure that their answers are, easy for the patient to absorb and not too clinical. I would say that's very important.
That it makes sense. I mean, we see it a lot of times when we're accompanying patients to physician visits where the doctor or nurse practitioner are answering it and in a very clinical way, kind of a unemotional way. And, you look at the patient and the patient's like thinking, I have no idea what they're saying. And you have to kind of like interrupt and say, wait, could you explain that? As like I'm a 6-year-old, so that people understand what we're talking about, because it's an important discussion.
Right. Medical terms, are just not understood by the average patient, I mean, those really clinical things. And I think that's really important.
Communication, I've often said this in my years at Guardian Nurses, but communication is really not only important, but I think it's the number one problem, challenge, however you want to phrase it, in healthcare, and anywhere, I guess, but particularly in healthcare, because it's people's health, it's people's lives. And if they don't understand what the issue is or what the treatment is, it's how can they have informed consent? Because they're just kind of nodding their head because the doctor's talking that way, and it's okay. So I applaud you for saying that, to ask questions and make sure you're understanding the answer, besides having a nurse by your side.
Exactly. I mean, that'll teach you a lot, having that nurse beside you.
Absolutely. Yeah. You have one of the best. So thank you for sharing your story. I'm sorry you had to go through that. I am so glad that you're okay. And that both your eye and your heart are okay.
Well, thank you. Thanks a lot.
And next time you go to the ER, don't forget to call us.
Believe me. I'm not putting my little toe in before I have an advocate with me.
That a girl. Good answer. Good answer. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you found our conversation helpful, please share it with your friends and leave us a review. You can learn all about how Guardian Nurses helps patients and their families when they need it most at our website, guardiannurses.com. So until next time, find some joy in your life and pet all the good doggies and kitties, and remember to tell your people that you love them.